Every winter, millions of Americans struggle with seasonal affective disorder, also known as SAD.
But this year, in the midst of a global pandemic, mental health advocates worry seasonal depression could take a harsher toll.
Western Mass News correspondent Naomi Ruckham explains the risks and how to deal with the disorder during this especially dark winter.
Gabrielle Starr was diagnosed with seasonal affective disorder in her late teens.
When I didn't have to go to class in college, I was just like in my bed. I wasn't working out. Like I would eat at really weird hours. I wasn't sleeping well.
Her symptoms of depression escalate as the season starts to change.
The first month, literally, of daylight savings time being over, my body is totally out of whack.
Doctors are concerned with the pandemic already impacting mental health. Seasonal affective disorder could mean an even darker winter than usual for many. Dr. Craig Sawchuk is a clinical psychologist at Mayo Clinic.
It makes it easier to forge through difficult times when you have a reliable light at the end of the tunnel. Unfortunately, with the pandemic, that light keeps getting pushed further back.
Add unemployment or a sick family member to the mix, and that could make even more people vulnerable to seasonal depression.
You may have folks operating at a little bit more of a deficit, heading into this time of year because of social distancing and really doing the right things from a public health standpoint, but they may already be in more of an isolation kind of mode.
Experts say staying active can help, maintaining a healthy diet, treating with therapy and medication, and finding a good source of light, getting outside, or investing in a special lamp. Gabrielle takes vitamin D, meditates, and practices yoga.
It makes a huge difference in my day. It's sometimes really hard to force myself to do it, but I always feel better.
She also uses an alarm clock that mimics the rising sun. Naomi Ruckham, CBS News, New York.
To get through the season, experts recommend sticking to a routine as much as possible and connecting with loved ones through video chat until the pandemic is over.